This model provides a description of the 5 moments of hand hygiene. At the end of this model, you should be able to describe the 5 moments of hand hygiene. Healthcare workers must perform hand hygiene before, during, and after healthcare delivery using the appropriate technique for the correct duration. Hand washing with soap and water must be performed before and after healthcare delivery. During healthcare delivery, alcohol-based hand sanitizers or rubs can be used to clean and disinfect hands as it is more effective, faster, and better tolerated. However, you must wash your hands with soap and water when visibly soiled. All healthcare facilities should have hand hygiene stations at various locations within the facility. Ensuring that alcohol-based hand rubs or sanitizers are available at point of care is easily achievable by using pocket bottles, fixing wall-mounted dispensers, and placing containers close to patient's bed, or undressing or medicine trolleys that are taken into the point of care. There are important distinct areas that are critical to healthcare delivery. They include the patient zone, the healthcare area, critical sites, and the point of care. Hand hygiene should be performed between these important areas to prevent the transmission of infectious pathogens or microorganisms. These distinct areas will be discussed in more detail next. The patient zone refers to the patient and the surfaces and items that are temporarily and exclusively dedicated to the patient. This could include items that are touched directly or indirectly by the patient or by the healthcare worker when delivering care. The patient's flora predominantly contaminates this zone. There are 2 critical sites within the patient zone. The first site is the critical site that is associated with a higher risk of infection for the patient. For example, an aseptic site or IV site. The second site is the critical site with body fluid exposure risk for the healthcare worker and the healthcare environment. The healthcare area refers to all surfaces outside the patient zone, which include other patients, their zones, and the wider healthcare environment. This area is characterized by the presence of various microbial species, including multi-resistant microorganisms. The point of care refers to the place where the 3 elements for healthcare delivery come together, that is, the patient, the healthcare worker, and the care of treatment involving patient contact. Now that we understand the important areas for healthcare delivery, let us proceed with the 5 moments for hand hygiene. The 5 moments for hand hygiene defines the key moments when healthcare workers should perform hand hygiene. It incorporates the hand hygiene indications recommended by the World Health Organization. It is an evidence-based, field-tested, and user-centered approach. But first, what is a moment? A moment is when there is a perceived or actual risk of pathogen transmission from one surface to another via the hands. The 5 moments for hand hygiene are: before patient contact, before aseptic procedure, after body fluid exposure risk, after patient contact, and after contact with patient environment. Why are the 5 moments important? The first moment, before patient contact, is important to protect the patient from harmful germs carried on the hands of the healthcare worker, other patients, or environment. The second moment, before an aseptic procedure, is important to protect the patient from harmful germs, including their own, from entering their body during an invasive procedure. The third and fourth moment, after body fluid exposure risk and after patient contact, are important to protect the healthcare worker and the healthcare environment from harmful germs from the patient. Lastly, the fifth moment, after contact with the patient environment, is important to protect the healthcare worker and the healthcare environment from harmful germs from the patient and their immediate environment. Let's look at these moments in detail. Hand hygiene should be performed on entering the patient zone and before patient contact. Direct patient contact can occur in situations such as when shaking hands or stroking a child's forehead, helping a patient to move around or get washed, applying oxygen mask or giving physiotherapy, and when taking pulse or blood pressure. Hand hygiene should be performed before an aseptic procedure. Once hand hygiene has been performed, do not touch anything in the patient's environment before the commencement of the procedure. Examples of clean or aseptic procedures include brushing the patient's teeth or instilling eye drops, skin lesion care, wound dressing, or subcutaneous injection, catheter insertion or opening a vascular access system or a draining system or secretion aspiration, and preparation of food, medication, pharmaceutical products, or sterile materials. Hand hygiene should be performed after any task that involves exposure to body fluids, as hands could become contaminated. Hand hygiene should be performed even if gloves are worn, as they are not a complete impermeable barrier, and hands may also get contaminated when removing gloves. Situations illustrating body fluid exposure risk include when brushing the patient's teeth, instilling eye drops, or secretion aspiration, during skin lesion care, wound dressing, or subcutaneous injection, drawing and manipulating any fluid sample, opening a draining system, or endotracheal tube insertion and removal, clearing up urine or feces, handling waste and cleaning of contaminated and visibly soiled material or areas. Perform hand hygiene after patient contact. Hand hygiene should be performed before leaving the patient zone. Direct patient contact can occur in situations such as when shaking hands or stroking a child's forehead, helping a patient to move around or get washed, applying oxygen mask or giving physiotherapy, taking pulse or blood pressure, or performing chest auscultation, and during abdominal palpation or recording ECG. Perform hand hygiene after touching the patient's environment, even when the patient is not touched. Hand hygiene should be performed before leaving the room. Contact with patient's environment can be made when changing bed linens, with the patient out of the bed, during perfusion speed adjustment, monitoring alarm, holding a bed rail or leaning against a bed or a night table, or when clearing the bedside table. The 5 moments for hand hygiene minimizes the complexity of hand hygiene and is applicable in any healthcare setting. It is also easily integrated into the workflow and is easy to remember. Please refer to the hand hygiene videos in the materials section for a step-by-step guide on proper hand hygiene techniques with soap and water or alcohol-based hand sanitizer.